Hi, my name is Priebe. I'm a research fellow at the Natural Resources Institute in the University of Greenwich. I'll be presenting some research that was done under the Amana grant and in partnership with the London School of Hygiene and Tropical Medicine, as well as the Africa Innovations Institute in Uganda. Part of this research was to find out whether we could use interactive voice response to measure dietary diversity in low-income rural settings. So I'll start by explaining what interactive voice response is. You're probably already familiar with it. If you call into your bank or your mobile phone provider, you'll probably be asked to go through a menu, which is basically made up of pre-recorded voice prompts that you then answer by entering numbers on your phone. You can use the same technology to conduct surveys. There's a couple of online platforms out there that are actually quite accessible. They work a bit like SurveyMonkey, and you can configure your survey there and also manage the sending out of your surveys. I'd like to start with some conclusions. We found that IVR presents a potentially highly scalable, relatively low-cost opportunity to collect dietary diversity in low-income rural contexts. Mobile access is still an issue, though, so you need to manage that. However, we found that once you get past that barrier, response rates and accuracy are actually unaffected by socioeconomic characteristics. So it's quite a non-biased method. We found that dietary diversity score and minimum dietary diversity score are also not statistically different from what we collected using observations. However, we found that individual food groups do vary. So you need to kind of configure your survey and pre-test your survey questions in order to ensure reliability. So why did we go for interactive voice response? As you all know, mobile penetration has grown rapidly in the rural, across the developing world. It's still growing, and we found that actually smartphone adoption is kind of lagging behind and is not likely to reach a kind of rural, more marginalized populations. So really, using technologies that use basic phones is the way to go. If you compare it to other technologies that run on basic phones, like SMS and USSD, literacy requirements for interactive voice response are much lower. And if you compare it to telephone interviews, actually the costs are lower and it's more scalable because you can do it in an automated way. We also saw that it has been used in nutrition research in higher income countries successfully, and it's already being used in quite a lot of other domains in lower income contexts, mainly to kind of push out advisory messages. So our study was done in Uganda, Bugiri and Kamuli districts. We sampled 212 mother and child dietes across 18 villages. We used 3 concurrent methods for collecting data. So we used observations, we used the interactive voice response, and we used 24-hour recall. Next to that, we also collected a range of socioeconomic data on our respondents. And at the end of the survey, we also asked respondents to evaluate the technologies that we used. So the IVR survey itself, to do this, we provided our respondents with a basic phone, and we sensitized them to the methods so that they would know what to expect once they were called. We're actually surveying them on their own diet, so the mother's diet, their child's diet, and on how they use their time throughout the day. So we called them at 3 different times throughout the day to cover kind of morning activities, afternoon and early evening activities. And in this research, we used the Viamo platform to kind of configure our surveys and do the calls. My presentation is only going to be focusing on the data that we collected on child diet. So just to look at our sample, most of the respondents are between 21 and 30 years old, lower educated, so primary education. Actually, 30% only owned a phone, but most of our respondents had access to a phone. Literacy rates are about half, and we estimated that approximately a quarter of our respondents would be living below the poverty line. So to start off with response rates, each respondent received 6 calls, so 3 calls on 2 separate days, and this was a bit of a challenge. We only had a kind of complete data record for 64% of the respondents. However, we found that 97% of our respondents were able to answer at least 1 call, and even 92% answered 2 calls. And after that, it dropped off. looking at response by village, there was actually quite a large variation there. So the best performing villages were able to complete about 83% of calls, whereas the lower performing ones only 38. So there was a large kind of variation there. So when we looked at what was affecting response, we tested for these separate indicators and found that actually none of the socioeconomic characteristics were correlated to a lower response score. It was more down to the contextual factors. So from some of the information that we collected afterwards, we found that human issues, which are just related to, say, interruptions, illness, the mother being absent, or the mother not feeling confident enough to answer the calls, affected response rates. And then we collected some data on kind of network errors. So this is reported by the platform itself, and it'll tell us whether the mobile network was actually able to reach the phone, or whether there was an issue with the network that caused the phone to a call to fail, or a call to drop out prematurely. And that was very correlated to our response rates. And we can estimate that about half of the calls that were incomplete were related to network errors. And this was also very correlated to the village of the respondent. So we just found that some villages just weren't covered very well by network signal, while others were. Looking at the data that we collected on child dietary diversity, we used two different methods that look at the data on an individual paired level. So the Cohen's kappa gives you some indication of concurrence between the two measures. So this is showing moderate agreement between the two methods. And this test is just looking to see whether there's enough evidence to reject the hypothesis that the two data sets are the same. And there's not. So statistically, we can see that the data collected between the two methods, observations and interactive voice response, are the same. If you compare that to the other traditional method that we use, 24-hour recall, the scores there are considerably better. And also we can see that interactive voice response is actually underestimating dietary diversity. So there's a trend for underestimation. And if you look further at why that is taking place, you can see that some of the categories are actually doing very well, while there's quite a lot of variation among other categories. So there's underreporting in terms of meat and fish, nuts and legumes, and the other fruits, whereas there's some overreporting of vitamin A-rich fruit and vegetables. And the interesting thing is that we're not seeing the same bias on the 24-hour recall. So this might be that there's more prompts going on the recall survey, so it's helping respondents to better remember what they ate, or perhaps there's something in how we ask the questions in the interactive voice response that we need to kind of revisit and make sure that we're collecting more reliable information. So we saw that response rates were an issue. I think one of the factors here were that we were conducting so many calls. So partially that was because we wanted to cover the time use proportion and add a level of granularity to that data. We feel that if we were doing it just focused on diet, we could actually just do one call, perhaps even on the next day, and that would allow us to try respondents several times to make sure that they can pick up the call at a time that's convenient to them and complete it. So we expect that would increase our response rates. Also, it would be possible to use, say, a dual SIM or the respondent's own phone. In that case, you're kind of increasing the chances of being on the right network, which would also increase our response. Also, the marginal costs are actually relatively low if you're doing interactive voice response, especially if you're using the respondent's own phone. So it would be relatively easy to increase your sample size. Finally, if you're thinking about the validity, we already found that the data is not actually statistically different from the observations. However, we feel that some improvements can be made there, and we feel that it's mainly due to the way the call is being administered. So we'd like to do some more research into this to see how many prompts and what kind of prompts would we need to improve the accuracy of this method. So that's why we would recommend to use more extensive survey pretesting. So to come back to the conclusions, we feel that it's potentially a very highly scalable and relatively low-cost way to collect data. So it's slightly different to the other methods that have been presented because it's less rich. So it only really works if you've got very specific factors that you're measuring, but on the reverse, it's actually very scalable, so it's quite low cost, and you're able to reach quite a large population. Thank you.